everyone. Myself, Dr. Priyanka from StudyMedic. Today we'll be doing OMR series, that is OSCE Made Ready, which will be really helpful in your MRCPI OSCE preparation. We'll be discussing today an important station. So, do not forget to like and subscribe StudyMedic channel, and also press the bell button icon so that you will get updated with the recently added stations. So, um, little progress each day adds up to big results. And so today we'll be doing the station where I will be the candidate and Dr. Soumya will be the examiner. So we'll start with the station.
Hi, Priya. Thank you. So, guys, Priya is going to do the commonly tested task. So, I'll be her role player, and probably towards the end, I would be giving a quicker feedback as well. So, Priya, I shall start the time. Once you're ready, you can start.
Hello, I'm Dr. Priyanka, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Hi, I'm Mrs. Samantha Ruth, and I'm 42-year-old.
Uh, how would you like to be called?
Sam is okay for me.
Sam, I can gather from your notes that you are 42 years old in your first pregnancy, and you have had blood test done, and you have come here to discuss the results of the report. Am I right?
Yeah, that's true because I was literally waiting for these results. Hopefully, the results are fine.
Okay. Sam, in a few minutes, we'll be discussing the results of your reports. But as we're meeting for the first time, can I ask you a few questions about you to know you better?
Sure.
Yeah, thank you, Sam. Sam, can you tell me more about your current pregnancy?
Yeah, actually, this is my IVF pregnancy that was self-funded because before, whenever I got it, like lots of time, they had given me medications, but nothing worked. And finally, IVF is the one which could help me to become pregnant. So obviously, this is a very, very precious pregnancy for me, and I've been really hoping everything has been fine. The scan which they had done in the beginning, it was fine, and they said that I need to undergo this test, and I have been started on aspirin as well. Apart from that, everything has been fine so far.
So first of all, Sam, congratulations for having this good news. Sam, any problems like any spotting or any excessive vomiting in this pregnancy?
No,
Okay. And can you tell me if you have any medical conditions like high blood pressure or diabetes?
no, I'm generally fit and fine.
Okay. And any histories of surgeries in the past on your tummy?
No,
Okay. And any family history of having any special child from your side or your partner's side?
no. As far as I'm aware, nothing like that.
Okay. And what is your blood group, Sam?
It's A positive.
Okay. And any allergies to any medications?
No.
Okay. Uh, so, uh, Sam, can I ask you a few personal questions regarding your
Sure.
life? Yeah. Do you smoke
No.
or take alcohol?
I used to do before the pregnancy, but not anymore.
Okay. That's good to hear. And any use of recreational drugs?
No.
Okay. So Sam, I want to ask you that this pregnancy is self egg, right? That is the pregnancy is uh, been by your eggs, right?
Yes, of course, of course.
Okay, okay. Sam, coming to discuss your report. So, I have confirmed your name and age and the hospital number, and this report belongs to you, Sam. This report is tells that the Down syndrome risk, the risk of having baby having the Down syndrome has come as high risk. That is positive.
Sorry, I didn't get you that. So that means that I have a child with Downs.
Uh, not confirm Sam, because this is a screening test, means that the risk has come as 1:45, means out of 45 women, there will be one woman who will be having a child with Down syndrome. The other 44 won't have a child with Down syndrome. Am I clear so far?
Okay, so that means to say there is a risk, but we are not sure whether my baby will have or not.
Yes, there is a risk, but this test shows that there is a risk. But to confirm that the baby has Down syndrome or not, there are further tests available, which can 100% guarantee that the baby can have Down syndrome or not.
Okay, okay. So what are those tests and what could be the risk with them?
So there are two types of tests available. The first one is called as chorionic villus sampling, in which uh, we do this test under the like the ultrasound guidance, that is the scan, and then we take the tissues through the needle. We take the sample of the afterbirths, and then we send it to genetic testing to see to look for the baby's DNA if the baby has Down syndrome or not. Am I clear so far?
Yeah, but it looks little risky. So will there be any risk to my baby?
So, Sam, as you rightly asked, so as this is a needle test, so it does carry some risk of miscarriage around 1 to 2%. So, out
Oh,
of 100 women undergoing this procedure, 1 to 2 will have miscarriage.
oh, okay.
Yes. And the next test is called as amniocentesis, where the same needle, through needle, the fluid around the baby, the sample of fluid around the baby is taken to look for the baby's DNA, if the baby has Down syndrome or not. So that will be also 100% correct.
Okay, so you mean to say DNA means the genetic makeup of the baby. That's what you are trying to tell me,
Yes,
right?
yes, yes.
Okay. And I have also heard that like one of my friend had that her blood got I mean she from the blood test only they could say whether the baby has got Downs or not. Is that true?
That test is also there where your blood will be taken. That test is called as non-invasive prenatal test, but still that is also 99.2% sure. It is not 100% confirmatory test. It is also a screening test, but it is better than the test which you have done right now.
So that means to say again it is like just like a screening test what I've got. So even with that again I have to do a definitive needle
But
test.
yes, if even if that test comes positive, it- then further a needle test is done to confirm the uh, diagnose, confirm the result.
Okay. What if I choose not to do these tests?
So we will respect your decision, Sam, that if you do not want to do this test, but uh, I would like to explain that what Down syndrome means. So can I explain, Sam?
Yeah, you can because I'm aware a bit about it. That I know that the babies looks very different and they have an IQ which is very less. I am aware of it.
Yes.
But the thing is, see, my point is I would want to continue the pregnancy at any cost, whether my baby has got Downs or not. But as you rightly said, I am in a little bit confused mind whether should I go for a definitive test or should I continue the pregnancy. So that's what my thing is. So what help I would be having if my baby has Downs, and what happens if my baby doesn't have Downs?
So Sam, if you want to continue pregnancy and if you choose to not to have this confirmed test, so we will be routinely doing all the routine care for your pregnancy, and we'll be doing the 5th month scan, which is to look for any structural, that is birth defects in the baby, and then a heart sonography also to look for the baby's heart if there are any birth defects, and having further serial growth of the baby, and there will be a team of doctors who will be looking over your case, if you wish to continue and if after doing this test, if you come to know that the baby has Down syndrome, if you still wish to continue, so there will be a team of doctors looking over your case, that is the my consultant, and then the uh, the doctor who specializes in the unborn babies, that is the fetal medicine doctor, and also the doctor who studies the baby's genetic makeup, that is the geneticist. So, and also the baby doctor. So we will referring you to the baby doctor so that they can explain what can be they may have variable intelligence, and uh, how the course can be. Am I clear so far, Sam?
Yeah. So I think you have given me an idea how to go about, and I would definitely want to go for a test. But probably if you could give me some information leaflets, I'll go back and decide and get back to you at the earliest.
Yes, Sam, definitely will be giving you the information leaflets about Down syndrome, and will also refer you to a organization called as Down Syndrome Society. And uh, you can take your time and think about what you want to decide, and then let us know. And also next time we can have a talk with my consultant also.
Sure. Perfect. Thank you so much.
Thank you, Sam, for your time.
Yes, you're finished on time. Yes. So Priyanka, I think it was a well done station. Uh, Probably like only thing which I felt was avoiding the percentages, because this lady would be definitely be worried. You could say like 1 out of 100 women with expert hands also, that is there, because that is was the thing which I wanted. And obviously, you are the one who should put across your thoughts about termination versus continuation. But because I said from the beginning that I would want to continue, I think that was fine. Probably you finished on time because I didn't have much to say. So obviously the confirmation test, and you answered correctly about cell-free fetal DNA also. And again, you better to avoid the percentages there. Otherwise, I think it's a clear pass station where you had helped me, and I wasn't very, very anxious, but in the exam, they could be very, very anxious where they would be asking a lot of questions. Okay. And in the beginning, when I said that hope everything is okay, you didn't acknowledge that much, and you went on with the doing the task. So probably if you could say that I can see you're worried, but don't worry. And probably you could have taken a chance there asking whether I want to know results first, or you would want to ask the history. Otherwise, I think it's a good one. Yeah,
Thank you.
yeah, you could just tell all the people viewing this about what is the important points which they should be covering. Yeah.
Yeah. So here, the important point is her like her age, and I 42 years she is, and she is also with the IVF pregnancy. So knowing that she already has a risk factor for the having a baby with Down syndrome, and then also regarding as she is 11 weeks, so she has to decide. But if she wants to terminate the pregnancy, the Irish law states that the pregnancy cannot be terminated beyond 12 weeks. So if she wants to terminate, so it should be before 12 weeks. And a proper counseling should be done in these patients, and talking sensitively with them, and giving all the options of both the screening and what does the screening test means, and also those invasive testing is also needs to be emphasized.
Yeah. If you could just take them through the slides very quickly, like the marking system and things like that.
Yeah. Yeah, so here we have to explain the results in case the result comes as Down syndrome. So what does Down syndrome means, and there can be the what all um systems are involved in the Down syndrome. We have to explain in the lay language, and what's the importance of doing the nuchal scan and dual tests in this patient is needs to be emphasized, as she is high risk for having a baby with Down syndrome. So. Then, as I said, that we have to discuss and take her views on deciding or continue terminating the pregnancy, and as it should be before 12 weeks only if she wants to terminate the pregnancy, and then we can give her patient information leaflets, and refer her to the National Down Syndrome Society. Otherwise, if she wants to continue the pregnancy, it will be like a routine care of pregnancy, and an anomaly scan should be done at around 20 weeks to look for any structural anomalies, followed by fetal echocardiography. And also, simultaneously, not to forget about her age. So, as she is an elderly primary gravida, so the specific care for the elderly primary gravida should be done. like as she is on low dose aspirin, and also monitoring for blood pressure and urine proteins, as she is high risk of developing preeclampsia and gestational diabetes. So that should be also taken into mind, other than only monitoring for
Yeah, the
Downs.
point is here basically because she's more worried about the down. So you will not be having a lot of time talking about this and termination. Yes, if at all, if comes in, you need to know about after 12+1, you won't be doing. And yeah, it's basically about appropriate counseling. And if she asks what further care, here the more thing is for her risk of downs and going about managing the thing. I think because that is what will take away your 10 minutes. So other than that, I think it was good. Thank you. Thank you so much, dear.
Thank you. Thank you, Dr. Sami.
Okay, guys, don't forget to like and subscribe. Thank you. Thank you, everyone.
Thank you.